So today we are going to be performing the range of motion test for the radial deviation. So you're going to have your patient sit down, place their forearm down on the mat table with their palm facing down. The axis landmark for the range of motion test is going to be at the base of the third metatarsal in the palm right here. The stationary arm is going to be in line with the midline of the forearm, and the movement arm is going to be in the midline of the middle finger or the third phalange. You're going to then move outward towards your thumb, just like that, and then you'll measure range of motion. So go ahead. She did about 35 degrees in her range of motion, and the normal is about 20. So she's above the normal range of motion. The muscles that perform this action are the extensor carpi radialis longus and the flexor carpi radialis. All right, so today we are going to be doing a range of motion test for ankle eversion. So you're going to have your patient sit down on the table with their ankles just barely hanging off. Their feet are going to be in plantar flexion with their toes facing forward. And then the axis landmark for this one is going to be the base of the third metatarsal. And then the stationary arm is going to be in line with the tibia, and the movement arm is going to be in line with the second phalange. So their patient is going to move their foot outward towards their toe, just like that, and then we're going to measure. So go ahead, go back, and then go ahead and move out. Range of motion was about 16 degrees, and the normal range of motion for this muscle is about 18 degrees. The two muscles that complete this action are going to be the fibularis longus and the fibularis brevis. All right, next we're going to be testing the range of motion of cervical. So we're going to have our patient sit down on the mat table with their legs dangling off. When we go up to the patient, we are going to line up our axis landmark with their ear. Our stationary arm is going to be lined up straight vertical above the ear, just to be perpendicular to the floor. And our movement arm is going to be in line with the nose. So our patient then is going to extend their head back as far as they can, just like that, and then come back, and we'll measure it. So, and go ahead. We got to a measurement of 70 degrees. Normal range of motion is 60 degrees, so she's just over that range of motion. And then the muscle that performs cervical extension is the splenius cervicus. All right, so we're going to be performing the manual muscle test for flexor carpi radialis. So we're going to have our patient sit down and place their forearm with their palm up on the mat table. The origin of this muscle is going to be on our medial epicondyle of our humerus, and then our insertion is going to be at the base of the second metacarpal. The action performed is wrist flexion, which is going to be just like this, and radial deviation, which is going outside. So the functional limitation of having this muscle injured would be not being able to like wipe with a rag or pull things off the ground during curls with your wrist. So for the manual muscle test, she's going to just flex up just like this with your hand. So go ahead and do that for me. And then I am going to resist here, just like this, against her pull. And she was able to resist and perform the full range of motion against gravity, so she would be getting a 5 for that test. All right, so our second manual muscle test is going to be our gastrocnemius, which is going to be our calf muscle. So if you can turn around for me. The origin of the muscle is going to be superior of the knee and inside, just inside the medial and lateral epicondyles. So it'll run all around right here. It inserts down below at the calcaneus, and its muscle actions are knee flexion and plantar flexion in the ankle. So the way the manual muscle test works, she's going to keep her legs completely straight. She's going to raise up onto her toes, just like that. And if she can complete 25 of those in a row, then she would receive a 5 on the manual muscle test. As she's doing this, we're going to talk about limitations. Her limitations, if her gastrocnemius was injured, would be jumping or being able to stand up on your toes to maybe reach something up on a shelf. But it's mostly limiting athletes or people that are moving quickly. So today we are going to be doing thoracic trunk extension manual muscle testing. So I'm going to have my patient come over and lay stomach down on the mat table. For this, the muscles are going to be attaching origin-wise at the spinous processes and the transverse process of the spine along here, and then the insertion will be at a superior transverse or spinous process as to be above it and allow the back to pull up. Extension is going to be her pulling up, so if she could put her hands behind her head, just like that, she is going to do a sort of Superman motion and pull her chest off the ground just like that while I hold her ankles down. She'll come back down. Since she was able to lift her chest off the table, she'll be receiving a 5 on this manual muscle test. Some functional limitations of this movement would actually create sort of a hunch in someone as they grow older because they're not able to extend their spine and straighten out their body, so their posture gets worse.